Hey, we're going to get started. So welcome. My name is Anne Gallery, and I'm the co-founder of MindWell-U. We are an e-health technology company that provides evidence-based training online to help people to support and improve mental health and physical health. And we run a series of webinars monthly, sometimes more often, on a variety of topics related to mindfulness and how they can support you in your work, in your personal goals. And this one, we're going to be talking about how mindfulness supports addiction. And I'm very pleased to introduce my friend and colleague, Dr. Geri Bemister. She's a professor and behavioral scientist and a member of the BC Recovery Council. And Geri was most recently appointed, her latest appointment is chair of the BC Centre of Substance Abuse Working Group, and she'll be working with a team of people to support vulnerable populations in addiction. And as you'll hear from Geri, she has a different view on recovery because she's about more about the recovery piece and not just the epidemic and the stats and so on. And you know, letting people wait out their disease. Geri is looking for active solutions to support addicted loved ones and the families. And so, Geri, why don't you elaborate on your capabilities and credentials here, because I know you have a ton of experience in this area, and then maybe I'll just sort of talk after that about how we met.
Certainly. So good afternoon, everybody. I'm grateful to be here. Thank you, Anne. So I've been working in this field about almost 15 years. And over the 15 years, I've worked in several different types of institutions, residential care facilities, correctional facilities, and then the academic institutions. So on Vancouver Island, I'm involved with Vancouver Island University and the North Island College in the criminology department, behavioral sciences and social sciences. I've received many credentials over the years and lots of training, mostly of which have focused on my expertise that I've built up in substance use disorder or addictions. So I'm actively engaged in practices such as intervening on the mental health issue that we call substance use disorder, most commonly known as an interventionist. It's one of the more favorable work that I do, not so much that I'm intervening on the illness per se, but because I get an opportunity to help the families that are attached to the addicted person, the loved ones, the family members. I get a lot of the joy out of the work that I do from that. So Satir training is another family models systems model that I've been trained in. My training for intervention comes out of the United States. And then of course I have a master's degree in criminal justice. The Canadian Counseling Federation is also part of my credentials. If you want to see further, some of the things that I've done, including an appointment by our former premier to the Blue Ribbon Panel on Crime Reduction, you can just Google my name. And if you have any questions about any of that, you can certainly reach out to me. Be happy to elaborate on anything else.
Thanks, Geri. And Katie, who is working behind the scenes, will post a link to your website in case anybody has any questions they'd like to reach out to you about afterward. Full disclosure, I met Geri through a personal way. My son at Christmas found out that he was using some pretty heavy-duty narcotics, and I would say that that was the most stressful, difficult time in my life, in my family's life. And we sent my son to a treatment center in Southeast Asia, and that was a huge, big undertaking. And right away, we were advised as a family to get support because addiction is a family disease. And so Geri was the top of the list in terms of recommendations on who to go to. And so while my son was in treatment, we we had a number of meetings with Geri. My other son did one-on-ones with Geri. My husband and I met with Geri. I met with Geri, and it was all about, learning how to not be an enabler, not be codependent, all these things that I knew nothing about before. This was all new to us and really sort of scary. But I wanted to sort of share my personal story to you, because I have this background in mindfulness and I work for a company in mindfulness, and mindfulness played a big part in my recovery and my ongoing journey with this, but it also really supported my son. He went to a treatment facility called The Cabin in Thailand, believe it or not. And mindfulness is a big part of what they teach. And I just, the pieces just kept on coming together and together and together. And so I found my mindfulness practice so helpful on this journey that I wanted to bring this to the MindWell community. I'm typically not the one hosting our webinars. That's usually left to my colleague, Dr. Jeff Soloway. So I'm a newbie at this, but it's coming from my heart. It's coming from a good place. And I really hope that some of the information that we share today is going to be valuable to you and helpful, because I know having a mindfulness practice was so helpful to me. And before I sort of turn it over to Geri, I guess the biggest ways that mindfulness supports me today, and, while we were going through this, I feel like because of my mindfulness practice, I was very aware and in tune with what my son was doing. I was not turning a blind eye, although I would have liked to. I was not in denial. I was not talking myself out of it or saying it wasn't a big deal. I was very aware. I saw things as they were. I saw it through a real lens of authenticity. And I really think that my mindfulness practice had something to do with that, because otherwise I know it would have been far easier to just not see what I was seeing. And so by seeing that and really recognizing what I was seeing rather than denying and clouding and all those things, we were able to take really swift action with my son and get him into treatment immediately. So that, I would say, is the first way that my mindfulness practice as the family member of an addicted person has helped. And the second way is, holy cow, is this stressful? As my son is 16. For those of you who have dialed in, who can relate, and it's just terrifying seeing somebody go downhill. And it's also kind of terrifying too, seeing them in recovery. And my son's doing so well, but I feel like I'm walking on eggshells and I'm trying not to. But my mindfulness practice really helps me see the positive, stay optimistic, be grounded in truth. Like, he's not using anymore. He's not using today. He's using his recovery skills. And I need to recognize that and stop catastrophizing and all those places that my mind wants to take me. And it's my mindfulness practice that keeps me grounded. And I keep going back to it because, my mind can go off, as minds do. But I think my journey in this family addiction or family disease would be a lot more difficult without my mindfulness practice. So before I hijack any more of this webinar, I'd like to sort of loop Geri in here. And Geri, I wanted to start by getting your sense of addiction in Canada. I think the majority of people here today are Canadians, perhaps North America. We all hear about the epidemic and the crisis in fentanyl, but you're out there on the front lines, you're advising the governments. What's the reality of that versus sort of what we may hear and see in the news?
That's a very good question and a good place to start, Anne. So if we look at some of the statistics from the Center for Mental Health and Addictions, they will roll out stats that I believe are in line with what I see on the ground, and that is that 1 in 5 Canadians struggle with a mental health or addiction disorder of some state. Usually 70% of that starts in adolescence or childhood. Men are more likely we're seeing men as a more likely candidates. The statistics are definitely higher. Mental illness and chronic pain are very attached as well. So I think when we talk about addiction, the media has really sensationalized one particular epidemic with the opioid crisis. In particular, here in British Columbia, we're really seeing a sensationalized focus on that. They've developed a center on substance use. They're really pushing these agnostic treatments, which are like a drug replacement therapy, which we'll get into later. And so I think that the picture, in particular in BC, we look at the downtown east side and we see a certain socioeconomic demographic in this particular location, and that's not true. If we look at studies from the Canadian Centre on Substance Use, for example, Life and Recovery Survey, if we look at some of like SAMHSA, some of the more legitimate individuals or institutions that are pushing out statistics, they will all show you that alcohol is actually the most widely used addictive substance. And that in Canada alone, we see over 4,000 deaths per year related to alcohol. And so when we're looking at that and then this current opioid crisis, the issues that we've had with alcohol addiction are historical, and those numbers are very consistent if we look back historically. So I think from my perspective, and I get it, we definitely have an issue with this opioid crisis and with fentanyl, but the focus is so much on this one particular problem with this one particular substance and this particular demographic that I think it's creating this huge stigma. So people who are actually struggling, let's say in West End, Vancouver, or in Toronto, in a penthouse apartment, somebody from a different socioeconomic status who might have a struggle with alcohol and is drinking every day and can't seem to get through a day without alcohol and can't quit, and wondering why, they're not sure if they have a problem or whatever, because they're comparing themselves to this social idea or this stigmatized idea of what an alcoholic or a drug addict looks like. So individuals who are suffering with chronic pain and are taking multiple medications, and then we run into this other issue that I think is more prevalent than most people realize, is this issue of diagnosing people with mental health disorders in conjunction with a substance use disorder. So concurring disorders definitely do happen, but at which point do you diagnose someone with a mental health disorder who has a substance use disorder? So mental health and addictions will say, well, they've got to be sober for 6 weeks or whatever before they can access services in mental health. Well, for me, we need to be able to get people into recovery. We need to settle down the brain. We need to get them practicing things like mindfulness, and to figure out where that actual person is dealing with the physical issues, the social issues, all of the other aspects of this complex disorder, and then be able to say, okay, do you actually have a chemical imbalance, or is it induced by? Do you actually have depression, or is it the properties of alcohol? Because most people don't know that the properties of alcohol, when you're withdrawing from alcohol or it's going through your system, create depression in the brain. Like these are not complicated concepts. Addiction is a complex disease, but it's not complicated in terms of how it looks in one's life. It does not have to look like homelessness, like sticking a needle in your arm. It doesn't have to look like fentanyl. So again, alcohol, marijuana, and cocaine are actually used more widely in Canada than opioids.
I didn't realize that. That's interesting, Geri. Mm-hmm. Where does mindfulness fit in the recovery process, both for the addicted person or the person suffering from addiction and the family member? Where do you see mindfulness interjected in that process of recovery, and what's the best place for it to go?
Well, I think before even the addict isn't into recovery, if you've got family members and loved ones who are interested in assisting their loved one to address their addiction, I would encourage individuals to try and focus on themselves to figure out what role are they playing, how have they been contributing to this individual's problem. And by that, I mean not an intentional way, of helping the person with their addiction, but things look like, providing money for your loved one because they can't seem to make their rent, when you suspect they may have a problem with drugs and alcohol, or you can't figure out where all the money is going that they're earning. Letting them live in your home if they've fallen on hard times because you suspect they may have a drinking problem, letting them live in your home, and then enabling that sort of consequence. So there needs to be a negative consequence in order for people to be able to create some kind of behavioral change. Because if we continue to enable any kind of behavior, in particular, many of you that have children can relate to this, anytime we enable any kind of particular behavior, there's no opportunity for the brain to change.
And so if the family member is getting trained in mindfulness and practicing mindfulness, they will be more aware that they're enabling?
Yeah, they'll become aware of what's really happening. So if you take a step back, like if you're giving your son, let's say, money, and you suspect that it's not going towards whatever he says, or he's being dishonest, or there is a suspicion there, if you have a good disposition in mindfulness and you're focused, you're going to have that strength and feel empowered enough to say, you know what, either approaching them or confronting them or saying no. Even though it's, your loved one and you want to help them and you want to believe them, if you've got that little tinge of, the mindfulness is really going to help you have that focus to create awareness in yourself and around you, so that then you can start to go down the path like yourself, Anne, where you started to investigate, you started to gather information about how you could help your son, and then learned that it wasn't just him that needed the help. And so in that recovery process, we're not just looking at the person with the substance use problem and saying, hey, you've got a problem, you need to fix it. It's like, okay, let's stand back for a moment and everybody sort of get grounded. Let's focus on the moment. What's really happening here? Let's look at the facts as they were laid out and what's really happening here. And then being able to take that one step further. So if the individual decides to get help, the loved one who's addicted decides to get help, the mindfulness for them is going to start at that exact moment. As soon as the fog begins to lift and the clarity comes back into the mind and the brain starts to work as it should, the physical ailments, usually within the first 7 to 21 days, a person becomes very, very well in terms of their brain and the clarity that is, the brain starts to rejuvenate very, very quickly after the substances have left there. So I think having that focus and that mindfulness will assist with someone to be able to realize what they're doing to their brain, realize what they're doing to their family, realize what they're doing to themselves, and start to understand the science of the addiction and the substances and the behaviors and everything else. And then because mindfulness can be used anytime, anywhere, at any moment, for any period of time, it's like, okay, someone is overwhelmed by the shame of their behavior, of their addiction, or a family member has shame because they've been enabling or assisting this person into, into addiction or furthering their addiction. It's like, okay, wait a minute, let's focus, let's take a step back. I'm in the here and the now. I'm not in, 20 years ago or 5 minutes ago when I gave them $20. I'm in this right now. I can deal with my anxiety. I can deal with feelings of overwhelm. I can deal with the fear. There's tons of fear associated to this for the addict and for the family. So, and then along the continuum in terms of the recovery on a daily basis, mindfulness is fantastic for almost anything, I would say, in terms of wellness, especially when we're talking about the brain.
Yeah, let me just flip that screen back, that slide. The brain has this neuroplasticity element to it, and we used to think that once you were 20 or 25 years old, like your brain was sort of set and it was all downhill from then. But now we know that the brain can change, and the brain will change based on what you focus on. Mm-hmm. So what fires together wires together, and so if you focus on being present and you focus on attention and being aware, your brain will start to wire those neurons together so that you become more aware more often, and you have a greater capacity to grab your attention and your catastrophizing in your fear and your what ifs, and bring it back to the present moment so that you're grounded. And I know that when we were sort of in the throes of my son and him going downhill and doing all sorts of crazy things, the fear was, and the stress was just almost, too much. But I found that when I was really stressed, it sort of short-circuited my intuition, and it kind of like I wasn't able to tap into like what I really knew to be true. So I really had to double down on my mindfulness, and was listening to podcasts, and was doing Take 5, which is something that we teach at MindWell. I was doing a lot of those because in that heightened stress, I wasn't able to see the forest for the trees. So we've got some questions popping up here. For those of you on the webinar, feel free to hit chat at the bottom of your video and post up some questions. I've got one here already. The question is mindfulness proven, and is it not just a nice to do? So thank you for that. No, it is proven. It's evidence-based. There have been hundreds of studies that show the efficacy of mindfulness. It's been around for centuries, actually thousands of years. And in the 1970s, it was shown to help patients with chronic pain where medicine wouldn't work for them, thanks to Dr. John Kabat-Zinn. So we know that mindfulness has all sorts of benefits. Geri and I can sort of talk a bit about those, but it helps lower stress. It increases resilience, which is really important both for the person suffering from addiction and their loved ones. Feeling resilient, feeling like you can ride the waves. That's a really important part of this process. Geri, do you want to elaborate a bit on how else being mindful can support the family in recovery and the person themselves?
Well, I think if we look at the Eastern philosophies, I think where mindfulness as we know it today came from, the act of soothing the brain or calming the brain, much like a muscle. If we think about a muscle when you're running a marathon and it gets cramped, or you're working out and it gets cramped, or it gets overworked. In today's society, unlike thousands of years ago when mindfulness was developed or practiced more regularly, I think, than it is today. There's a lot of stimulation coming into the brain in today's world with technology and all these other things. And so we stimulate the brain, and then if we look at the substances on top of that, this poor brain is being inundated with, information and stimulated, and it's firing away. And then at the end of the day, or during those times when we feel the brain being, utilized as a muscle, the mindfulness is a way for us to be able to calm that down and have that balance. Because then if we get a brain that's overworked, then we're dealing with creating cortisol and stress levels, and then it impacts physical health, and it's all of this, very cyclical, very connected, problematic issue when we are not using mindfulness as a way to integrate into our recovery, if you will, or your education. So it's much like anything else that you learn in life when you go and you learn Excel, or you learn Word, or you learn how to, whatever it is course that you're taking, you learn that, then it becomes part of your life. And whatever area of your life it's needed, you utilize it because it's education. And I think mindfulness is the same way. It just becomes another tool in our toolbox. And there's never enough tools in one's toolbox when we're dealing with the issue of addiction or mental health. Families alone have, generational trauma and these other belief systems that are passed down, and families have their struggles in terms of staying healthy. So I think it's pivotal, it's key.
Right. That was one thing that you taught me about codependence and how that can go down generations. I mean, that's just kind of blew my mind. I have one of your slides here that I can show about codependence, and you can see from the slide, you know, the characteristics. You know, you're feeling empty, you've got low self-esteem, shame, anger, confusion, numbness. You know, MindWell works with a lot of hospitals, and we deliver our 30-day mindfulness challenge to healthcare professionals across North America. And one of the things that we hear is that numb out is now worse than burnout, because when you're burned out, you know it, and chances are others around you know it, and they're going to say, okay, you need a little holiday, you know, go to bed, we'll take care of whatever you need a break. But when you have numb out and this numbness, you're so fried, you don't even know what's going to help or make you feel better. You don't even have those skills. And so when you look at what mindfulness is shown to do, you know, it improves optimism, it lowers stress. You know, anger is often a result, as you would know, of fear and stress. And, you know, mindfulness can help really put things in their proper perspective. And it really helps with clarity. As I said, you know, confusion is the bottom of the list here. And, you know, when you're mindful and you're aware, it's a lot easier to be more, have greater clarity and to be able to take the tough steps. You know, when my son was, you know, I think at the end there, he was doing lots of things. But like, holy cow, sending my 16-year-old to treatment in Thailand, that was a bold move, even for me. And so I don't think I could have done that without some real fortitude. And I know I didn't really have that before I started practicing mindfulness. So that was a big benefit to me. I have another question here. Where can I learn mindfulness? So there are many, many different places to learn mindfulness. It is a skill. It's a practice. It's a living practice. It's like, you know, going to the gym. If you want to maintain those, you know, great abs and a fit physique, you need to work it. And so the same thing goes with mindfulness. It's a practice that you need to sustain. And the good thing is it builds on itself. So, and the other good thing about mindfulness is there are outcomes in as short as a couple of days. So there are, you know, courses probably in your community. If you go to your community center or look up MBSR, mindfulness-based stress reduction, that's sort of the gold standard of mindfulness training. And it's great. I've done an MBSR course. It's 8 weeks and it's homework and it's, you know, quite involved and intense with a daily practice. And so not everybody is ready for that. And that's why at MindWell-U, we created something called the 30-Day Mindfulness Challenge, where we teach this practice called Take 5. And it's something that you can do in the middle of everything or anything, because we know people don't always have time to sit and meditate, as great as that would be. So with Take 5, you know, you can do it driving the car, about to walk into a meeting, on a stressful phone call, or wherever. So there's, you know, online courses somebody could take who wants to learn mindfulness. There's in-person courses, there's retreats. There's many, many different ways, and a good Google search would probably get you started. One thing to look for, though, is that the training is sort of rooted in neuroscience and grounded in some research. Mindfulness is sort of everywhere these days and on the cover of magazines all over the place. And so some folks have jumped on the bandwagon, as what happens with things that are becoming popular. So just make sure that you're looking to see that there's some real science behind the training. Yeah, and of course, if you go to our website, you can look up the 30-Day Mindfulness Challenge, which has been studied by the Sauder School of Business and shown to have many outcomes. And that's why, you know, we work with the government and hospitals and so on, because they're looking for that rigor of the training. Geri, what do you think is the biggest barrier right now to people getting into recovery more quickly and more effectively?
Well, that's a big question.
I know, sorry.
That's a very big question. So again, I would go back to the stigma. I think there needs to be a cultural shift. So at a high level, I think there needs to be a cultural shift in terms of our attitude towards addiction, substance use disorder. My experience, just before I go into depth and answer that, my experience has been, as also a person in recovery, I've been in recovery from addiction disorder, substance use disorder for 14 years next week, actually. And so, yeah, speaking from that lens, I can tell you that the cultural shift needs to happen. So I stayed very, very unwell for a very long time because I was socialized with the idea of what that picture of an addict looked like. And in my experience, the resiliency that I see in myself, and the resiliency and the motivation and the dedication and the positive citizenship and the outcomes that my life in recovery, what it looks like, was the life that I would have liked to have had when I was unwell or before I was treated. And I think that the idea of someone in recovery or someone recovering from addiction is less than or is not normal is okay, because I believe that we're exceptional. I believe that we're not normal. I believe we're above normal if we look at this bar that we would call normal. I don't think that we're less than. We are a group of individuals who have faced a very serious chronic fatal illness that's recognized by health, the Canadian Medical Association, European Medical Association, American Medical Association, is a chronic fatal progressive illness. So in other words, it's just like cancer.
Yeah.
So we're dealing with a demographic of individuals who have faced a serious illness and recovered and excelled. So in my experience, true recovery from addiction is not taking a replacement therapy. So not, if I'm an opioid addict, taking a replacement therapy, like a methadone.
Like methadone, are you talking about? Yeah.
Yes, if I was to do that, then my lifestyle is improved and my harms are reduced. Absolutely. However, I'm not able to excel because my brain is still, and my body is still reliant upon a substance and dependent. And so I'm not getting to that place where I'm actually truly getting well. And, I'll make a bold statement and be totally transparent here. This is my personal opinion, and it's also backed up by a lot of research. And I think is not well known in the propaganda or the rhetoric that's out there right now in terms of these opioid replacement therapies, is that, the risk for death if a person goes on methadone or Suboxone and then tries to come off of it to go abstinent, which is the recovery model that I support. And I support methadone and Suboxone as a continuum to get someone to abstinence, to get that true recovery that they need for their illness. But what I believe is that we're leaving people stuck, and that we're leaving them with this idea that if they stop using it, their risk for death increases. Yes, that's actually true. And I believe that, and I support that statement. But what I also would like to see encompassed with that statement is the fact that that's the same for any person with an alcohol problem or a cocaine problem or smoking. So if you're a smoker, right, and you decide that you pick up smoking after 25 years of not smoking, you've just increased your risks for many physical medical issues.
Right.
Well, that's the same for, right, including death. And that's the same for an opioid user, or it's the same for an alcoholic, so there's long periods of abstinence. So for myself, as a former stimulant user and an alcoholic, if I was to start to use substances after we got off this computer today, my risk for death would be very high. But if I spent the last 15 years on some kind of anti-abuse in my system to negate the brain, in some way to calm that area, or synthetically deal with cravings or any of these other things, rather than dealing, developing internal tools and cognitive tools and physical tools and social tools, where would I be? Like, where would I be? And so there's this idea that this is the only way, and that opioid addicts are, beyond repair, and they're beyond having a life like myself. And that's just not true. If methadone and Suboxone are used in a harm reduction model along a continuum, it's very possible for someone to attain, the life that I've been able to attain in recovery. All of these credentials and accolades and awards and the advocacy work that I have done in my life, my professional career, has all started once I entered into recovery. So, 14 years ago, I was, and this is a personal disclosure, I was addicted to cocaine, alcohol, marijuana, and then sort of using any other substances in between. And my body had started to shut down. My mind was so polluted with chemicals. I didn't know what day of the week it was to take my garbage out. I was obviously unemployable, and probably very, very close to death, within days of death. And, the social stigma was something that contributed to my delusional thinking around the fact that I didn't have a problem. I thought I was doing great. Well, I was homeless. I had eviction notice on my door. My car was no longer functioning. I had no money in the bank. And my 14-year-old stepdaughter that had been living with me was couch surfing because she couldn't be in the home. So not being able to see the extent of my illness is another thing that I think people don't realize either, is that this disease has many symptoms attached to it, and denial, delusional thinking, rigid defensiveness. So when we approach people and they just get like this bravado, these are all very, very important pieces that don't get talked about at all.
When my son was away for treatment, I felt a lot of shame, and I don't today, because here I am telling all of you about my personal story. But at the beginning, it was really tough, and wow, how could I have a son who's a drug addict? And I've since learned it's nothing to do with backgrounds, education, that means nothing. And so, that was another way that my mindfulness practice really helped, because I did feel, this is my fault. Where have I gone wrong? How could I have stopped this? And, when you're going to really see things for what they are, I didn't cause it. I can't cure it. I can't control it. Mindfulness really helped with that. I see another question here about, oh, thank you. Somebody named Erica said, amazing stories. Thank you for sharing. Thank you. It feels kind of good to share now. Another question is around mindfulness for caregivers in addiction facilities. And yes, that's really important. We work with, as I mentioned, MindWell works with hospitals and seniors' homes and a variety of different treatment centers, because those caregivers, professional caregivers, and caregivers at home, they have a big burden. And it's a very, very stressful job, whether you're doing it for a loved one at home or as a paid position. And yes, mindfulness is an important tool in the workplace. It not only will lower stress, as we've talked about, but it will increase optimism, it increases focus, it increases and improves teamwork and collaboration. So, burnout and numb out is at sort of chronic levels, as we hear from our hospital clients. We work with hospitals across Ontario. We also provide mindfulness training to the entire health network in Saskatchewan. And we just started training every citizen of Newfoundland and Labrador now gets to take the 30-day mindfulness challenge, which is very cool. But those professionals, whether you're at home, you need resources, you need tools. That's a very stressful job. I keep saying to my mom, uh, you know, you should really learn mindfulness, because my dad's slowing down. He's 85 and she's, just starting to do more care. And she needs to do some self-care too. And mindfulness is a great way to practice self-care. Do you see professionals, Geri, in treatment centers that you know of or work with who are trained in mindfulness and who have that capacity?
I do, and then I see those who are not. And the difference is, the most significant and most serious difference is that those unhealthy behaviors, the issues that surround not having some type of mindfulness practice as a form of their self-care sort of plan in their lifestyle can, and this is the serious part, is that when we're dealing with our clients, they're vulnerable. They're completely vulnerable. And so they are more actually susceptible to any kind of transference. So if you've got an individual who is a provider in a treatment center, a frontline worker, or whatever it might be, a social worker giving the locks on downtown east side, or someone working in a high-end, private facility that does not have, that mindfulness practice and self-awareness, they run the risk of transferring any sort of toxic mindset, toxic belief, toxic energy, unhealthy behavior or attitude. They have a real, very real possibility of transferring any of that toxic stress onto a vulnerable person who's trying to move through a very crucial phase of getting well, right?
I wonder too if that person who doesn't have the skills and the training and the tools to deal with that, I'm assuming then that they'd also transfer that to the home?
Yes. So let's say we're dealing with a helping professional who might be a counselor, and that person may or may not have other problems like marital problems or family problems, and then they're working in a field where they're probably working more hours than they should, and they have slipped in their self-care, and so they've really become their work with the clients has become their only source of that, dopamine or endorphin release, is this helping. And then when they get home, they find that that's not their happy place. The work is the only place that they're getting that release in the brain. And so when they're getting home, they're not getting it because they're having to exude, whatever kind of caretaking role if there's children, or they can't be present in the relationship. And so it actually transcends into all areas of their life. So they might say, well, I don't care about, CRA, or I don't care about this, that, and the other thing. And then all of a sudden their life slowly begins to fall apart. And then the client becomes more of the focus, and this reliance upon helping the client becomes very unhealthy in that clinical relationship.
Yeah, and I'm guessing that's what's going to lead to that burnout and numb out that we talked about, right? You can only sustain that for so long. Yeah. And I would imagine too, if I didn't get help with you, or, it could be any family therapist, but, I would have been heading towards numb out and burnout too without, my mindfulness practice, but also some extra outside help saying, okay, time out, guys. Like, let's look at the big picture. Let's look at the triggers. Let's look at all the different elements that are going on here. Mm-hmm. How important, Geri, is it? I mean, you're preaching to the choir here, but how important is it for family members to get support when they have a loved one who's in active addiction?
Well, it's critical, because I think without help, you're not going to be able to think your way outside of the box. There's absolutely no way that this can be managed with any kind of good intention, or no matter how educated you are or not educated you are, no matter how much work you've done on yourself, this disease permeates any kind of healthy part of your life that you've built up. So unless you're continually having a spiritual practice or a mindfulness practice, and you have people in your circle to give you feedback, and you're maybe speaking to a therapist, and you've got a healthy lifestyle in terms of eating and exercising and all of these things, then what's going to happen is this addiction is going to erode not only the addict, but the family. So it really looks like the addict is in the middle, controlling the emotional state, sometimes the financial state, people's moods, everything. That addict is in the middle, controlling everything of all the people around it, including, it might be a workplace, it could be the mother, it could be the partner or whatever it is. And then, by the other people getting well, whether it's through an intervention or whatever that might be, the addict moves to the outside and starts to feel the consequences of their behavior, and everybody here can support one another.
Yeah,
right?
and get well.
Getting well. And so that's how it works. And what will happen there is, if this person doesn't decide to get well right away when the changes start to happen here, eventually they will, because they want to be with their family. They want to be loved. They want to be well, but they can't quite see what everyone else sees. And so by, this united front of the family and the loved ones and whoever else, getting well, practicing mindfulness, seeking education, seeking knowledge, seeking support, that other person eventually will want to be involved in that. They will see the family recover. It's much like even people with addiction disorder, when they recover, it becomes very attractive to other individuals. Right? And so same with the family. When the family starts to get well, the addict will also be like, or the alcoholic or the person who's unwell will start to be like, hey, wait a minute, like, you guys are all doing this, like, maybe I want help now. Okay, I get it. Right? Like the perspective changes. If we bring this right back to the basis of communication, we have communication. And in family systems, what happens is we develop habits or neural pathways, right? So if, Anne and her son, for example, were used to communicating in a certain way, and then Anne seeks help, or Anne uses one of her mindfulness tools, or changes her perspective and changes the way that she communicates, her son doesn't have a choice but to communicate. But what happens, much like a neural pathway, developing in the brain, is that this communications that we have in family systems get so worn like a path, that in order to divert from that path, it almost becomes impossible when it's just the two of you communicating the way you've always communicated. So either one or both people need new information to change the way that they communicate, so that it becomes healthy, as opposed to this resisting sort of, well, I already know what they're going to say. I already know how they're going to react. Well, okay, so what about if you changed? So it's this baiting of communication, and you would be amazed what happens when someone applies what we call a boundary, whether that boundary
That was all new to me when you explained that to me.
yeah, like physical, emotional, spiritual, like we say, we can tell as humans, we can tell when we're in toxic energy or toxic people. We can feel like, if we're mindful, we know what's going on with other people to a certain degree. We absolutely do. So for yourself, if those of you out there, if you don't want to have that negative energy around you, whether it's with your loved one who might be addicted or not, or just a toxic situation or whatever, it's really about creating that boundary around yourself, and then figuring out what it is that you want in your space. Why does this impact me? And why do I keep going back to it then? What is my excuse that allows me to keep being near this person? I'm not getting what I want, but yet I keep going back and thinking it's going to be different, right? It's like, no, I need to set a boundary. If I really want to be in whatever relationship it is, to whomever, then I have to change first. And then if the other person follows suit, then you create this new platform for communication. But the boundaries are key. I mean, they really are, and they're hard. They're hard. Because enabling and caretaking and all of these, unhealthy practices that contribute to fostering the continuation of someone's addiction or unhealthy behavior all come from a good place. So setting a boundary for people is so foreign. It's so hard. Like, it's so hard. Saying no to your child when you know that maybe they've been abused or they've been addicted or they've had a traumatic experience, and you just feel so badly for them. But if you don't set that boundary and make the change, everything's going to remain the same. One
of the things, I keep coming back to my mindfulness practice, and I guess that's okay, because that's what we're here to talk about. But I had so much to learn when my son went to treatment, and Geri, as you know, I had no idea that I was a part of any of this. Geri came to my house to meet with my husband and I think between, the tears, she got the message through that, we were part of this problem, and I couldn't understand that. And so it's still a kind of a strange concept, I have to say, but I get it now. And so there's all these things that I need to do differently. I thought it was just my son had to do things differently. And so these things that I need to do and the way I need to communicate differently and not communicate, they're really foreign for me. Like, they're not the way I roll. And so I have to be very aware, because I'm automatically going to say what I would normally say. And my mindfulness practice helps me remember and to think before I speak and to respond instead of react. That's one of the big things we teach in the 30-day mindfulness challenge, that mindfulness gives you this pause. So you're not always on autopilot, we're reacting all over the place, and that you can pause and respond. And how I communicate with my son, as you've just said, is really important. And it's an important for his recovery. Like, it's kind of a big deal, bigger than I thought it was. And so being mindful of all of that is really important and helpful to me, because I think otherwise I'd just be doing all the same old things and pushing all the same old buttons, and we wouldn't be in the healthy place that we are today.
Absolutely.
Geri, there's a comment here that says how much optimism and hope that you've given someone watching, and that, that you're so together and accomplished, and, you shared that a while ago life was different for you. And so that's always nice to hear, I'm sure.
Thank you.
We have another comment here. Someone's just finished the 30-day mindfulness challenge. It's been a great experience. I could see how this could have helped me in the early years of my husband's addiction and its effect on our marriage. It makes me wonder where we would be now had I known this before. Yeah, I mean, unfortunately, sometimes we don't learn new skills and new ways of doing things until we've hit the wall. Certainly, that was my experience, at least in understanding enmeshment and enabling and all that stuff. I didn't even know what I didn't know what boundaries were. I didn't know anything. And I only found that out once we were in addiction in my family. I suppose these are just sort of some life skills that we can benefit from. Certainly mindfulness is. I know that it's taught in schools now to elementary school students. And so it is going to be a core competency for, populations coming up, but it's not for my age group. And even my teenage sons, they didn't learn mindfulness in school. It's sort of the kids after them. So I do think that this is going to become a more commonplace, regular part of training. At MindWell, we call it brain training or mind exercise. And, exercising your brain is just as important as physical exercise. And I think that more and more of us are going to be learning the skill because it's so important. And whether we learn it in the workplace through our employer, or we take steps ourselves to learn these skills and have this capacity, it helps in a bunch of situations.
I think at the bottom here, Anne, there's a question about how they can get the counseling in Edmonton.
Okay. So we will reach out to you. Certainly the 30-day mindfulness challenge is available online. It's just on your phone. So we have, WestJet takes our training, for example, and pilots are doing it, and flight attendants and the sales folks, and even the mechanics and the technical team. So there are online trainings out there like the 30-day mindfulness challenge that you can have, right in the palm of your hand. But certainly please reach out to us, and we can talk about our online training as well as our in-person training. Geri, any last words about, maybe giving some hope to folks out there, either like me, caring for a loved one or having a loved one going through addiction, or, somebody caring in a facility for that population or even the person themselves?
Yeah, immediate action and even small steps will help. So this is not something to be put off, and anytime that you're educating yourself for personal wellness, not only is your life going to change, but it's going to impact people around you, have this huge ripple effect. And then, one last comment, you can certainly visit my website. I think there's going to be a landing page, it's called.
That's right, yes.
The lingo. But if you need to reach out to me, my email address is on the website. I'd be happy to refer you to a colleague if you're not in the areas where I work. So as the services provided for many addictions professionals can be online. So a lot of the times it's not about using these conventional methods, about going into an office, paying someone a large amount of money and then putting on a timer. It's really just about finding individuals that are a fit for you, that you're comfortable with, that you feel safe with, and that have the knowledge that you want. Just because someone is recognized or this, that, or has many letters or is associated with this doesn't mean they're great. They have to be a fit for you.
Right.
So, yeah, we'll be happy to sort of field any of that further questions, I guess, through our websites and such.
Yeah, well, thank you very much, Geri. And as Geri mentioned, we'll make this recording available on a landing page. We'll send it out to you in the next few days. Feel free to share it, pass it along. We'll include a couple more resources. Thank goodness I have my mindfulness practice going through what we've been going through. I encourage others who are in the same boat, practice self-care, whatever that looks like for you, and pray to whoever, some of those things are really helpful, and there are tools and resources out there. And so immediate action, as Geri said, was so critical for us. And I don't think I would have had the guts to take such swift and immediate action without my mindfulness practice. Mm-hmm. So I encourage you out there to explore, different ways to bring that tool to your toolbox, because there's many, many, many benefits. So thank you very much for joining us today. We will send you the link to Geri's website. She's offered to point people in the right direction if you have questions. And of course, there's lots of resources and mindfulness practices at MindWell, which is MindWell-U.com. And I see some more questions popping up, so we will we'll try to respond to those directly after this webinar. But thank you all for joining. We have other webinars coming up, so please visit our website to check those out. And we really appreciate your time and attention today. And Geri, thank you so much for joining us. All the best. I'll see you again soon, I hope. And thank you very much for joining us.
Okay, then.
Okay, take care, everybody. Bye-bye.